part of the economic engine of any country is the health of their population. Without health, there's not a lot of wealth. So clearly, the issue, not only from a humanitarian perspective, but even from a selfish economic perspective, is to ensure good health of the population. Access to the normal population health of, clean water, housing, all of those things, but also good health care as well. So it's not surprising that this is now occupying center stage because it's a very, very important facet of the economy. I look at it from three aspects. The aspect of access, the aspect of better quality, and the aspect of productivity of people working in the system. And from the aspects of access, we're now in the realm where clinicians can get access to somebody's entire health history. We're now very much in many of the provinces producing the right health information at the right time to the right individual, which means that for the client, the patient, it's a lot more comfortable. They're not having to repeat their histories over and over again, because clinicians now have access to all their medications, their lab results, their diagnostic imaging. Furthermore, that we've cut down on the number of duplicate tests that need to be done, because they can never find those tests in the paper world, and they've been able now to get immediate access to them. In the area of quality, clearly one of the biggest issues was drug-to-drug interaction. Now they can look at medication histories as they're prescribing the next medication to see whether in fact it's going to interact with what the patient's already on, and the warning signs come up that they should actually, this is going to have an adverse effect and they should try something else. So that was a big issue. The issue of communicating between the different providers, where a lot of the communication was missed in the paper world, has now been brought to the fore, and there's much better communication, which cuts down on system errors and medical errors. And when you think about productivity for radiologists, the PAC systems now, which are ubiquitous across Canada, have improved their productivity by 25 to 30%. And that's a good and bad news story, because the good news story is they can be a lot more productive. The bad news story is the way the system is funded. It's going to cost a lot more money for the single payer, for the governments who are paying. Now, they can fix that by basically changing the price of what they pay. But the bottom line is they become a lot more productive. There is also a fourth benefit. It's an economic benefit. When we had a major spend around digital health, what we saw is a huge number of jobs being created in the economy. And I brought in the Conference Board of Canada, which is an independent think tank, economic think tank, and they did the study in terms of the number of jobs created, especially when we needed them during the recessionary years of 2008 and 2009. Besides, you start to grow companies, and there's many companies, obviously in India, that will have international appeal. They're homegrown, and then they become global. So a lot of those are some of the benefits. Now, turning to India, I'm sure there's issues around access that could be improved with this level of technology. There's issues clearly around safety as well that also can be improved. And the issues around productivity are basically there to be had. India leads the world in the level of kind of software development or developers that they do. Unfortunately, India gives away a lot of its intellectual property and knowledge, which then lands up in parts of the Western world. It would be wonderful if India could harness that expenditure and homegrown for their own population, at the same time growing the companies from a global perspective. Firstly, just to be clear, the Canada Health Act guarantees a universal system, which means a single payer system and healthcare for all. It guarantees a comprehensive system, and when it started, that comprehensiveness was about your general practitioner, your primary care doctors, and your hospitals. That's become a problem in recent years because we're now spending more on drugs, and drugs are outside the system. We're spending more on aspects of nursing homes, and they're sometimes outside the system, or long-term care homes. And the governments are looking at how they bring that into consideration. As people move from one province to the next province, they're guaranteed portability, so they get the same coverage between the system. In Canada, and this is a huge debate, that although all our doctors are small business people, the system is still publicly administered. And one of the aspects which is a real challenge, is accessibility. The country is only got 33 million people. It's huge land mass. And so there's parts of the country where it's so difficult to provide the same level of care that you get in downtown Montreal, downtown Toronto, or downtown Vancouver. But with the advent of digital technologies and remote consultation and virtual consultation, that is becoming more and more of an opportunity that can be fulfilled, or a black hole that can be fulfilled. The parallels between India and Canada is both of them are federated systems. They both have states. The states have their own level of powers, their own level of taxation. But the federal government also has a very major role, and the federal government can put in place an umbrella which says we expect the states to do certain things. Now, within that, given India's culture of involving the private sector, which is a wonderful thing, they have to work at a framework of how the private sector cooperate within that umbrella system, where nobody is left out in the cold. A very good example, quite frankly, would be the U.S. system. The U.S. system is spending 18% of their GDP on healthcare, yet they've got millions and millions and millions of people who've got no coverage whatsoever. They've got many people who are completely bankrupt because in their old age or any age, they basically need very expensive operations. So you've got to try to overcome that, and I think that the Obamacare tried to do that. But now there's a lot of discussion, it's backtracking, whether they're going to accomplish that. So that's the better parallel where India is and where the US system is. And let me tell you that spending 18% of your GDP and not having people covered is rubbish. It just doesn't even make sense. We're spending close to 12%, 11%, and I don't think we're getting value for money. We can do better than that. I think, the NHS system in Britain is spending probably 7 or 8%, and they're covering the entire population, and they're getting pretty good value. But there's no ideal system. Every country has to decide for itself. But at the end of the day, it goes back to the fundamental mandate that healthcare is a right. And if governments come to that understanding that healthcare is a right, they come to the understanding that the health of the country depends, and the wealth of the country depends on the health of the people, then that will drive major change. Well, healthcare insurance, nobody firstly wants to get sick, right? But eventually, most of us do get sick. And when we get sick, we need some help, right? If you can assure your people that when they get sick and they really need that help, whether it be a chronic disease like cardiovascular, cancer, diabetes, they're going to get help, right? That's when you put in place an insurance system. And it doesn't necessarily have to be a government insurance system. The insurance systems in the Netherlands are private insurance systems, but government has said there has to be an insurance system in place, and it's fostered the private sector and in private insurance companies from putting these things in place. You've got to get a sense where insurance companies or the insurance can't be selective and cannot say, if you've got a prior condition or if you've got a chronic condition, I'm not going to insure you. Because once you do that, then you're going to get this major population who can't afford healthcare, who don't get healthcare. So the insurance is really a level of comfort. This is how are you ensuring that healthcare is really a fundamental right of a person? And that's what insurance comes down to.